We looked specifically at objective measures of disease activity for this audit. So when we're assessing the dermatological response, we looked at the mSWAT scores at patients prior to treatment and at peak response. So mSWAT is as an objective measure of skin disease activity as you can have, and that you calculate the percentage of the total body surface area that's affected by disease, and then you multiply that by a weighting factor for the severity of disease. So when affected by patches is a factor of 1, plaques factor of 2, and tumors is a factor of 3. So we assessed where their skin was at prior to treatment and then at peak response. And then in terms of assessing their hematological response, there's a few factors that we look at when we look at the flow cytometry results of patients with Sézary. So the CD4, CD8 ratio, it's typically more than 10 in patients with Sézary. And they also experience loss of CD7 and CD26 in their expression. So you get like high levels of circulating cells with our expression of CD26 and CD7. So you can assess the levels of those cells. So that was the main ways in which we assessed response to treatment.